Okay. Hi, Hannah. Thank you for your help today. All right, what we're going to do is we're going to get you to lay down on the mat. All right, so just lay in a comfortable position. Okay, lay in a comfortable position, and what we'll do is we're going to have you bring your legs up. Okay. Oh, sorry, just bend the knees. Bend them up. There you go. Just like that. Great. Okay, so we're going to go through a couple of tests to check your abdominal separation because you are now 8 weeks postpartum.
Yes.
Right. Great. So what we're going to do is we're going to do some, we're going to test it without activating our pelvic floor and our transverse abdominis, and then we're going to do a second check of with the activation. Okay? So, do you know what abdominal separation is?
Yes, I have a slight idea.
Okay, so basically the idea is that you've got 4 layers of, abdominal muscles. You have your abdominis rectus, and then you have your external obliques, internal obliques, and then you have your transverse abdominis, which is the bottom one that runs all the way from the back to the front. Okay? So in pregnancy, your belly will grow and grow and grow, and then you've got this connective tissue right down the middle called your linea alba. You might have seen it when you were pregnant, like the darker line coming up on your belly.
Yeah.
So that's the part, that's the connective tissue that actually stretches in pregnancy. When your belly gets to a point it can't stretch anymore. And when we're measuring for abdominal separation, that's what we're measuring, like how much that has stretched out. Because when your belly goes back, you'll be left with a little gap. Sometimes it's no gap, sometimes it's 4.5+ centimeters, right? Okay, so what we're going to do first is, do you mind if I put my hands on you and I'm going to test you in 3 areas?
Sure.
Sure? Okay, great. Are you comfortable lifting up your shirt a little bit so we can test? Okay, perfect. Thank you. Okay, so first thing that we're going to do is we're going to get you to so we're going to test your pelvic floor, all right? So there's a couple of things to know with pelvic floor. I can't see what's happening on the inside, so I'm going to be relying on you to tell me what you're feeling, all right? So I'll give you some cues, and then you just let me know where you're at with them, okay? So what we'll do before we activate that, we're going to test for your separation. So can I just get you to take a natural breath in? So I say natural breath, like just let your shoulders go. Just if you're someone who naturally flares your ribs out, just kind of pull them back inside, and there should just be like a little easy gap, like a natural gap at the back. Okay, the base of your spine. Okay, so take a normal breath in. Good, normal breath out. Okay, now we're going to do a normal breath in. On the second breath, exhale. Sorry, on the exhale on this one, I want you to do a little curl up. Okay, and just hold that curl up. You don't have to do a full sit up. We don't want that. Just a little tiny one. Okay. Okay. So normal breath in, and then on the exhale, curl up. Okay. So I'm gonna go 1. I'm gonna check just right there above your belly button, just below it. Yeah, well, you actually don't feel like you have much separation at all, if anything. Okay. Now put your head down. Inhale and relax. Okay. So how does that feel?
Good.
Feels okay when you're curling up? No pain or anything like that?
No.
Wow, that's great. I mean, from the onset, it doesn't feel like you have much, but we'll see how we go. Okay. Okay, now what we're going to do is I'm going to show you how to activate your pelvic floor. So when you were pregnant, were you doing any pelvic floor exercises?
Kegel exercises.
Okay, Kegels. So you're familiar with the idea, but what we'll do is we're going to run through the whole thing again, just so we get the breathing right and we know that if you're activating it properly, okay? So your pelvic floor, obviously, it's a sling of muscles. It's like a sling of muscle that holds all your internal organs, right? So this is really critical for, obviously, pregnancy and then postpartum. So we want to make sure that we've got some good pelvic floor health in that, like it's not too tight or it's not too loose, and that we're doing things in your workout program to support it. All right. So when we say activate your pelvic floor, I want you to think of like 5%. All right. So when I say like activate your pelvic floor, I want you to do 5%. Most women go like sure, and then like brace everything, and it's like oh gosh, you know. So go 5% of that. All right.
Okay.
All right. Now what I would like you to do is we'll just get our hand movements positions so that for when we move into our TA activations as well, our transverse abdominis, that we know where we should be feeling things, okay? So can I get you to put your thumbs on your obliques here, okay, just on your obliques, maybe come up a little bit higher, and then take the tops of your fingers and put them across your hip. Yeah, great. So when you're activating your core, you'll feel these muscles switch on, all right? All right, so this is really critical for both activations that we're going to do. You don't want to feel your obliques turn on, because if your obliques turn on, it means you're clenching everything and you're not activating the muscles from within.
Okay.
All right? So I can't see what's happening on your pelvic floor, in your pelvic floor, but I'm relying on you to tell me if you can feel your glutes activating. I'll be able to, there's only so much I can do from like look and feel, so if I can see your glute flex, I'm like, okay, wrong muscles that we're recruiting for. Okay. So what I want you to do is I want you to imagine that you've got a little blueberry at the base of your vagina, like at the opening of your vagina, okay? And what you're going to do is you take a normal breath in, okay, normal breath in, and I want you on your exhale to pick up the blueberry, okay? So hold it for 1, 2, and release, okay? Release, okay, good. Get nice and relaxed. All right. We've got a little guest appearance over here. Okay. Okay, let's try one more. Okay. What we're going to do is we're going to take one more breath in. Okay, so a natural breath in. Take a natural breath in. Good. On your exhale, I want you to pick up that blueberry. Okay, hold for 1, 2, and exhale, release. Good, now let it relax. Okay. I'm going to put my hands on you if that's all right. I'm just going to hold right under here and see, do you feel anything like your glutes activating?
I don't think so.
No. And like from what I can see here is I can't see your stomach muscles contracting while you do it, which is great. All right, what we're going to do is we're going to try a second activation, so like a jellyfish. Okay? So you know how like a jellyfish swims, where like they contract up, and when they go to swim away, they kind of release and they go like this. Want you to take just one of your hands, keep your other hand on, okay? Take your other hand off, and keep one hand on. And when you draw in, I want you to, okay, with your hand, like connect the hand with your actual breath, okay? And on your contraction, breathe in. On your contraction, let go with your hand. Okay, hold it there. Yeah, so breathe in. Hold. 1, 2, and release. Okay, so with this one, what I want you to do is try, and I can see your stomach is moving a little bit with there. We'll do it one more time. Okay, so ready? You're going to take a natural breath in. On your exhale, I want you to draw the muscles in and release. Okay, so it's going to be like, sorry, I think I mixed up the explanation. So you're going to breathe in. On your exhale, I want you to lift your, again, okay, so you're basically going like this. All right, 3, 2, 1, take a natural breath in. All right, on your exhale, release. Sorry, on your exhale, pull in your pelvic floor. Good. Now relax and release. Good. Okay, great. We'll do that one more time. You can use your preference, the blueberry or the jellyfish. It's up to you. All right, and we'll go take a natural breath in. Good. I want you to activate your pelvic floor. Good. Great. Okay, perfect. So, what we'll do then is we're going to activate your transverse abdominis. So that's that one that goes across the bottom, and you've got your muscles that connect to the fascia down below, and they run horizontally. So basically, what these ones do is they contract this way. When you activate that, I want you to picture if you've got like a pair of underwear on, okay? So you've got a pair of underwear on, and you're trying to separate your skin from your underwear. Okay, so like you want to separate this area just from your underwear. But again, 5% of what you think. So don't go like, like don't like suck in your pants to like put on a pair of jeans, like just like a little bit of separation, okay, between your underwear line and your skin.
Yeah.
Another way of looking at it would be is if you're trying to pull your hip bones together.
Yeah.
All right, so if you're trying to like just bring those hip bones together. Okay. Now what we're gonna do, put your hands on here. So you got your hands on your obliques, all right? So we're gonna go like this, right? Good. And keep these like this, so that when you activate it, you don't, if you feel your obliques switch on, all right, we're gonna stop the movement. So basically we just wanna recruit the transverse abdominis down here. Okay, so is it okay if I put my hands on you?
Sure.
All right, so what we're gonna do is I want you to, we're gonna activate your pelvic floor. Okay, take a natural breath in. Good. On your exhale, do you want me to pull your pelvic floor? Good. Now, what I want you to do is pull your hip bones together. 3, 2, 1, relax and release. Good. So I didn't feel any movement of your obliques switching on.
No, I don't think so. Yeah.
Yeah, no, I didn't. I can see too, like you didn't really move at all. That's really good control. Excellent. All right. Okay, now what we're going to do is we're going to do the whole thing. We're going to package it all up together. And we are going to activate our pelvic floor, activate our transverse abdominis, and I'm going to get you to do that curl up. I don't want you to again, keep in mind, it's just a small curl up, and it's only 5%.
Yeah.
Okay. Okay. He's okay. That's all right. He's used to this. All right. So take a natural. Hold on a second. We'll just show you. Hi, bud. Hi. Hi. Okay.
There he is.
There we go. You want to come play with us? There we go. There we go. You can come play with us. Okay. Sorry about that. Okay. All right. Now what I want you to do is you're going to keep your hands there. Keep them on your thumbs on your obliques and your hands on your transverse abdominis. Again, if you feel your obliques tense, or if you feel when you're recruiting your pelvic floor, like if you feel any part of your glutes like really squinch in, like you're trying to hold in wind, then we don't want that. All right. Yeah. Okay. So here, hands on. 5%. I want you to take a natural breath in. Okay, on your exhale, I want you to activate your pelvic floor. Good. Now I want you to focus on drawing those hip muscles, or the hip bones together. Good. Now, I want you to take a natural curl up, or a little curl up, and we're going to check it again. Yeah, wow, great. And put your head down, exhale, and release. And release your pelvic floor. Good. So you want to take a big deep breath in, and then you can release the whole thing. That's really great. My gosh, like Hannah, you've got, wow. That's, as someone who had 4.5 centimeter gap, I'm like, oh, wow. What's it like? All right, that's good. So the one thing is that we've noticed there hasn't been much difference, like you don't have any separation. In fact, like when I put it down, like it's like if you have any, it's very, very minimal. Again, there's only so much that I can tell, like which is within my scope of practice and things like that. But there's only so much I can tell from looking and seeing. But just from doing the little checks in your 3 spots there, can't feel anything. If anything, it's like a little bit of a gap, right? Like,
yeah.
But what I would recommend is, have you ever been to a women's health physio before?
Before no.
Before no. Okay. So you're now 8 weeks postpartum. That would be a great time to go and see a women's health physio, because you mentioned in your pre-health survey that you like to do yoga. You're doing walking, which is great for postpartum anyways. But seeing a women's health physio can give you like a look on the inside of what's happening. So they can do like a real-time ultrasound where they get you to activate your pelvic floor, draw your TA, and you actually can see the muscles doing their job.
Sorry, I went last Friday, but before pregnancy.
Oh, I see. Oh, pardon me. Okay. You went last. Okay, so did they do a real-time ultrasound on body?
did not do.
Oh, okay. Well, if
Well,
you ever
we
have,
did some touching and testing, yes.
yeah, did they do an internal exam?
Yes.
Yeah. Okay.
Mm-hmm.
Yeah. So it's really fascinating what they can actually tell from like looking and feeling, and they're having like they can see like, oh, your pelvic floor is doing this, it's doing that.
Yeah.
That's great. I really got so much out of it when I did it. I was like, oh my god, things I didn't know. So if you are to go back, I would actually. Did they ask for you to come through for a follow-up appointment?
They did, but honestly, I'm not sure if I'm going.
Okay. Well, is it just because you're not sure? Like, I would recommend going. I would recommend just because if you do want to migrate into like a more robust exercise routine, like as you come back and you're building your strength back up from the inside, it is good. And maybe ask them to do like a real-time ultrasound, and they can show you exactly what is happening on the inside there. All right, you can put that back down. Sorry, it's a little bit chilly. There you go. Great work. Do you have any questions for me at all?
All good?
Yeah, good. And it felt okay when you're curling up?
Yeah.
Yeah?
Yeah, that's.
Doesn't, no pain?
No.
Wow, super mama. Awesome. Oh, it's not just luck. Here we go. Great, thank you.